There's not. Okay, so I'm going to call out. Hello, my name's Martha. I'm a student paramedic. What do you like to be known as?
My name's
Sarah.
Okay, Sarah, I'm just going to come round. So as I came in, I was using the resus guideline of Dr. ABCDE. I know that the airway's clear because she did respond to me, so I'm just going to look at the breathing, looking for equal chest rise, seeing what the breathing's like, if there's accessory muscles. She was speaking quite fully, but I can assess that a little bit more. Okay, so circulation. So I'm just going to touch your hand, just going to squeeze your finger a little bit. Is that all right? So just doing the cap refill, getting consent, making sure, do everything like that. I can also get the obs on quite quickly, looking at the kind of colour, if she looks clammy, anything that may suggest that it could be a cardiac red flag. Okay. And disability. So now just going to shine a light in your eye if that's all right. So just ask to look at my nose, shine the light across, and I look if they're reactive, look if what the sizes are. If need be, if I'm suspecting a stroke, do a fast test, just ask her to squeeze my hands, things like look, smile, see how she's talking. Okay, so once that's done, that's the end of bed assessment and the red flag sort of Dr. ABCD approach complete. So now I just want to try and get a little bit more information about what I'm doing. So first of all, I'm going to start by doing some obs. Okay, so Sarah, what I need to do is just stick something on your finger and just do a little couple of tests on you, if that's all right. So put the blood pressure on. So for a blood pressure, the perfect blood pressure is around 120/80. Yep. However, anything over 90/40 can be considered hypotensive. Anything over 140/110 is hypertensive. And blood sugar, so we want 4 to 5.9 according to the Diabetes UK. Temperature, anything 35 to 36 point. No, pause it.
I don't even know what I'm doing.
No, they're on my notes.
It's because I put you off because I had to crawl under.
You paused it.
Oh yeah, I haven't paused that one.
Okay, so I think it's 36.1.
No, that'd be way too obvious, wouldn't it?
Oh, God.
Okay. Okay, so I'm just going to do the obs here. So what I need to do, Sarah, just do a couple of tests on you. Is that all right? Okay, so if I pop the SATS probe on, so I am looking for a heart rate between 60 to 100, looking for SATS 96 and above, depending on if they've got COPD. 98 to 100 is the preferred one if they haven't got any COPD. I'm also looking for a blood pressure. So we want 90/60, anything underneath is hypotensive. 140/90 is hypertensive. The perfect blood pressure is about 120/80. That's according to the NHS. So if I do the tympanic temperature, so Bates says 35 to 41.1 is within normal range. However, that's normally outside of range for 41.1. The NHS website say anything over 38 degrees is hypothermic. Okay, so blood sugar is going to be 4 to 5.9 according to the Diabetes UK website. Okay, I'm just going to do a respirate. So the Resus Council says anything 12 to 20 is within normal range. And as I said, I've already looked to see what the breathing is. So just going to feel the radial as well, just to see if it's regular, just even though the SATS probe. What are the obs for Sarah, please?
So she's got a heart rate of 70. Her rest rate is 20. Her SpO2 is 99% on air. Her blood pressure is 130/85. Capillary refill was under 2 seconds. She's alert. Pupils reactive. Her blood glucose is 9. Her temperature is 37.2, and the environment looks fine. There's nothing to know in the environment.
Okay then. So from that information, just going to start thinking about things that it could potentially be. Have you got diabetes at all, Sarah?
No, I don't.
No. Okay. So your blood sugar is a little bit high at the moment. When was the last time you ate?
Last night.
Last night.
Yeah.
What is it you had?
Just a sandwich because I was feeling
Just a
sick.
sandwich. Okay then. So what I need to do is just going to have a little chat with you, really, just to find out exactly what's going on, if that's all right. So, can you give me a history of what's been happening the last couple of days and what led you to call for an ambulance?
Well, I just started getting this pain in my stomach about 7 o'clock last night, and it's carried on all night. So I just thought I'd get checked out, really.
Okay, so you've got this pain. Is it there at the moment?
Yes, it is.
Okay, so I'm just going to ask you some questions about that. So I'm going to use the JR Calc Socrates approach.
Yep.
So first of all, whereabouts is it? Where's the site of the pain?
So it's sort of everywhere, but it's a bit worse from the right-hand side.
Okay, the right-hand side. Is it all across the right-hand side or the upper, lower at all?
All across the right-hand side.
All across the right-hand side. And whenabouts was it when that started?
About 7 o'clock last night.
Okay, and how would you describe the kind of character of this pain? Is it kind of a stabbing, a squeezing? Is it a crushing pain, an aching pain?
It's sort of a dull pain, but then sometimes it gets worse and it becomes more of a sharp pain.
Okay. And you said on the right-hand side, does it radiate anywhere else? Does it go into your back, down your leg, across your stomach, into your chest at all?
No.
So no chest pain, nothing like that?
No.
Okay, and any associating symptoms that you've had with it? Have you had any vomiting? Have your bowels been opening normally? Have you been passing urine normally?
I was sick this morning.
This morning?
Yeah.
Oh, okay.
I'm feeling a bit sick.
What did that sick look like? I know it's not the nicest question.
Just really fluidy, bile.
Fluidy. You didn't notice any blood in there, any kind of black tarry or
No.
red? No?
No, nothing like that.
Okay. And with this pain, is it there all the time? Does it come in waves? Does it worsen?
It's constantly a dull pain, but then it does get worse at times.
Okay. So you're saying it gets worse at times. Is there a position that helps it, or is there a position that makes it worse, or anything that you do that makes it worse?
Not particularly, no.
No. How about when you go out like walking, you're getting up and about? Is that okay?
Yeah, it doesn't make it worse or better.
Okay then. And so if you could give me a score out of 10 at the moment, Sarah, 10 being the worst pain you can imagine, 0 being no pain at all, where would you put it?
At the moment, it's probably about 3.
A 3, okay. Have you taken any pain relief?
Yeah, I did. I took some ibuprofen and paracetamol.
Okay.
This morning.
What time was that?
About 8 o'clock this morning.
Okay. So you are within the time of taking it, considering how many you've taken. So we should make sure that she has waited at least 4 hours.
Mm-hmm.
Shouldn't take more than 6 in a day. She's saying that she's taken ibuprofen, but there is an empty stomach, so that can cause pain. So we've got to consider that at all. Sarah, did you feel that painkiller helped at all?
A little bit, not too much though.
A little bit.
Yeah.
How comfortable are you at the moment?
Yeah, I'm quite comfortable.
Okay, so I'm just going to explain what I'm going to do next. Because of what you told me, I'm not worried about red flags at the moment. The obs were quite stable. She doesn't look particularly unwell, but obviously she has got this pain. We need to look at it further. So Sarah, what I need to do, I'm going to look at your hands, like your fingernails, look up your arms. I'm going to have to inspect your face, look at your neck, and then finally expose your stomach. I'm going to do some prodding, poking, listen with the stethoscope, all these things just to try and get to the bottom of this pain. Is that all right?
Yeah, that's perfect, thank you.
Okay then. So Sarah, are you comfortable at the moment?
Yes, I am.
Just a warning, when it comes to me doing your stomach, I am going to have to lower you down a little bit.
Okay, that's fine.
Okay, lovely. So I'm just going to start by looking at your hands. So I'm going to inspect the fingernails to begin with. So I'm looking for any spoon nails.
No, there's none of that.
No, okay. Any clubbing?
No clubbing.
Okay, and any peripheral cyanosis?
No peripheral cyanosis.
So the spoon nails, that can be because of iron deficient anemia, can be because of a bleed. The clubbing, that can be, normally it's caused by respiratory disorder, but it can be known to be IBD, irritable bowel disease. It's just like an increased flow. And then the cyanosis, again, can indicate that there's a bleed because the blood flow is not sufficient. Looking at the palms, so we're looking for palmar erythema, so reddening. That can be due to the liver and it's not being able to clot the blood properly. Okay. Done. And finally, right, Sarah, what I want you to do, just put your hands in front as if you're going to give me a high 10. And then if I see any sort of involuntary flapping, hysterexis, again, that's an indication that the liver could be having some liver disease or some cirrhosis. Okay, so is there any evidence of any of that?
No, that's not clear.
Okay, so just lifting up your sleeve a little bit, Sarah. Lovely. So there's no evidence of track marks, is there?
No.
No, if I did see track marks, it just increases my suspicion of hepatitis. I also look for any patachi, which is, again, it's like the pulmonary erythema. It's kind of blotches of the red caused by the liver not being able to filter the toxins and be able to cook properly. Okay, so I've done with the arm and the hand. Just going to move to your face a little bit. I'll cover you up there. Okay, so first of all, just looking at the overall colour of the face, is there any yellowing, any jaundice? If I'm worried, I can pull the eyelid down there. Sarah, I'm just going to pull your eyelid down, have a look at your eyes. So I'm looking for any jaundice, which is caused by liver cirrhosis and the build-up of bilirubin. Okay. Also looking around the eyes when I'm doing that, you can look at the whites of the eye for the jaundice. You can look for the ring, the arcus senilis, around the outside of the eye, or little white droplets around the eye and the nose here, and they're both caused by hyperlipidemia. Okay, exothalassemia, it's those little dots there. Okay, and while I've pulled down the eyes, if I looked at the conjunctive pallor, that can indicate, again, similar to the hands, is the iron deficient anemia. Can be a bleed, can be diet, can just be hereditary. Okay, looking over the face and looking for a little bit more central cyanosis. If I ask you, Sarah, to stick your tongue out, not only can I look for the central cyanosis, but any signs of dehydration. Okay, is that all okay?
Yeah, that's all fine. There's no signs on any of that.
Okay, so now I'm going to look down the neck. So first of all, just going to feel the like the nodes in the neck and the glands, just to see if there's anything that is swollen. So in there. In the throat, I know it's not overly comfortable. There is also quite an important one just above the clavicle, the Virchow's node. Just going to palpate that to see if there's anything swollen there. If it can be an very early sign of stomach cancer. But is there any sign of any of that?
No, that's all fine.
What I'm going to do now, I'm just going to get you to turn your head a little bit. I'm going to look for the external jugular vein, internal jugular vein pressure. So I get the patient at about 45 degrees, which I think they are. Go look at this side. So I'm going to ask you to turn your head just towards that way, away from me. That's it, towards the right. And just looking from about the end of the clavicle here up towards kind of the jawline. If we see any more than 4 centimetres on the internal jugular vein, then that indicates that they've got hypertension, like portal hypertension, again, leading us to believe that the liver isn't functioning properly. So that's it, you can turn back now.
Yeah, there's nothing to note there.
No? Okay. So what we're going to do now, Sarah, is the part where I need to just expose your stomach and I need to do the prodding and poking. Is that all okay, Sarah?
Yeah, that's fine.
Lovely. So I'm going to take the jacket off. So for now, I'm just going to keep us sitting up. I'm just going to inspect. So I'm looking for any scars. This can indicate kind of previous surgeries, give me an idea of previous health conditions that she has. If there are any, depending on where they are, I can ask the patient or just use knowledge to know what they're from. Any scars?
No scars.
No? No stoma bag. Again, that comes with the scars of previous kind of medical conditions that she may have had.
No stoma.
Okay. So no scars, no stoma. So looking for any spider nervae. So it's similar to the arms and palm. So we've got, see if there's any kind of reddening for the liver cirrhosis not quite working properly. Mm-hmm. Nothing like that?
No.
Right, so maybe some caput medusa, which is just the kind of, it's enlarged veins which indicate the portal hypertension as well, with the liver not working properly. Nothing on that?
No.
Looking for, I know it's different with Sarah, but if there's male, they can have excessive growth of the breasts, gynecomastia. So that again will indicate that there could be obesity, could be an underlying cause. Any distension or stray there, anything like that? No. I can always ask Sarah, does your stomach look normal to you?
No. Yeah, it looks fine.
Yeah, okay. No hernias at all?
No.
No, okay. Okay, so finally what I'm doing is just going to look for some bruising, okay? So if there's any around the flanks, you've got the grey turners, that can indicate kind of any sort of bleed. And also, in rare cases, pericarditis, and the Cullen sign as well, which is around the umbilical. Yep. This can indicate a ruptured AAA. and also if there's going to be an ectopic pregnancy, that could be a sign.
Yeah.
Also with the AAA, before it ruptured, we can see a pulsating mass. That's normally, if you imagine where the aorta is, push up a V towards the ribs, and then you should see a mass that's pulsating. If you see that, it's a big red flag for the AAA. But there doesn't seem to be any
there's no
kind of
sign
massive
any of that.
distension.
No.
Okay, so we're quite happy with the stomach.
Yeah.
Okay, lovely. So what we're going to do now, I'm just going to auscultate if that's all right, Sarah. So I'm going to get my stethoscope, try and warm it up best I can.
Why do you want to auscultate at this point rather than go on to percuss?
Because if you percuss and palpate, then that means that you can disturb the stomach, and then it can create noises that wouldn't have been there if you hadn't have palpated.
Okay.
So it's really important to auscultate first. So I'm going to get my double stethoscope. So what I'm going to do is just listen to at least 4 quadrants. You can opt for 6 or 9 quadrants as well. It wouldn't be quadrants then. So just listening to bowel sounds. If I can't hear any bowel sounds, I'll continue to listen to 2 to 3 minutes until I'm quite convinced that there's not that could indicate a blockage. So stethoscope's warmed up there a little bit, Sarah. Just going to listen to your stomach. Let me know if there's any sounds. Okay, so I'm quite happy that I heard sounds quite quickly on all of those. Okay, so what I'm going to do now is just do a weird little tappy thing on your stomach, Sarah. Might be a little bit uncomfortable, but just to make sure that we haven't got any sort of fluid there, just going to lay down a little bit. So pop my finger there, making sure no other fingers are touching, just tap it. Okay, so listen to see what it sounds like. If it sounds quite dull, that could indicate that you've got excess fluid there, but it's quite tympanic. I'm happy with that. If I were to listen to something and then it sounded quite dull, especially on the sides, what I can ask Sarah to do is roll onto the side. So if the dullness was here, I'd keep my finger there, ask her to roll onto her right, keep my finger on there, wait for 10 seconds, do that again. If it then sounded that it was tympanic, it was quite loud, oh, carefully roll there, then that would indicate that you've got free-flowing fluid, which could be ascites caused by the liver cirrhosis. So it's important to do the shifting dullness test. Okay, so I'm quite happy with all of that. Was there any sort of red flags with that?
Not with the shifting dullness.
No. Okay, so what I need to do now that we've just assessed that there's no excess fluid, we are going to test just for your percuss, a weird tappy thing on your spleen and on your liver, if that's all right. So first of all, we're going to start with the liver. So starting around the level of the umbilical, and I work my way up. And then the second one, I work from the nipple line, work my way down. So on the right side, just start on the anterior. If there is an enlarged liver, normally around there, be quite dull. Okay. Okay, so for a liver, we want it about 8 to 12 centimetres long, about 6 centimetres high, and it's around the 5th rib. Okay, now we're going to go on to the spleen. We're going to do something similar, however, instead of percussing up and down, we go around to the side. It's quite difficult to palpate the spleen unless it is enlarged. It should be 3 by 5 by 7 centimetres, and it's in between the 9th and the 11th rib. So pause it for a sec.
You're doing really well.
Do you come across like that?
For the spleen.
For the spleen.
You with the spleen, yeah. Show me what you're doing.
So it's kind of, you go like this.
Yeah, across.
And it's just to see if it remains.
That isn't what I learned.
What did you learn?
To percuss in between the last intercostal space, then get them to breathe in, and if it suddenly sounds dull, then
See, I had
But you're going
2.
across.
yeah.
Are you going across in yours? No,
No,
you're
it
staying
just
in one
says you
position.
stay in the anterior axillary line.
Yeah,
Was that Bates?
But can
Because
we
Bates
do,
had 2 different ways of doing it.
can you do yours your way?
Yeah.
And you do coming across.
Yeah. Because there was the breathe in as well. So if it does sound dull, to get them a deep breath in, because that's what it says to do.
Yeah.
Okay.
I think mine was a Stanford medicine website.
Okay.
Yeah.
Happy?
Yeah. I just keep forgetting things.
No, you're doing brilliantly.
You're doing well.
You really are.
Cool. I'm trying to get in the same position that I was in before. So just tap in there. So just going towards the mid-axillary line till if it starts to sound dull, take a nice deep breath in. If it remains dull, then that could indicate an enlarged spleen. Okay, so I'm done with all the tapping thing. Both those tests came from Bates' book there. It is quite hospital based as opposed to pre-hospital, however. Okay, so that's the tapping done. What I'm going to do now is just a few little tests that involve pushing into your stomach, most of which just to test for something called appendicitis. Is that all right with you, Sarah?
Yeah, that's fine.
Yeah. Okay, so first of all, we're going to do the test for appendicitis. I'm firstly going to find McBurney's point. Okay, so that is on the right-hand side, making your way up from the kind of the ilium crest, about 2 inches up towards the umbilicus is about McBurney's point, so that's according to Bates. So it's about here. If I palpate and then release, if there's pain on the rebound, that indicates rebound tenderness. It could be a positive sign for appendicitis. So if I do something very similar on the opposite side, so again, it's the pain on the release and the pain and palpate. If it radiates over towards the appendix area, the McBurney's point is a sign of appendicitis. I'm just going to take this blanket off, Sarah. I'm going to make you do some strange things with your legs.
Okay.
There you go. Oh, we've had a hot ambulance out before. You've got the ECG stickers on. Okay, so first of all, what I'd like you to do, just with that right leg, is just pull it up towards you, and then I want you to rotate the upper leg in and push your upper leg out. Okay? So you bend up like that, twist in and out. Is there any pain there?
No,
No.
that's fine.
So that's the obturatorus. Okay? So the next one I'm going to do is just the psoas. Okay, so what I'm going to do is ask you to lay more on your left-hand side, pull your right leg back. That will stretch the muscle, which can cause increased pain and pressure on the appendix. So again, you just turn onto this side, pull the leg back. Let's pretend that's gone well. Any pain on that?
No, that's fine.
No?
No.
Okay. Pause. Can we try that again? Fucking hell. Maybe we should have got a person in. Maybe you slut, cover yourself up. Cool.
Do you want to do it again? I don't think you need to.
No, that's some comedy.
Oh yeah. Mine's full of comedy. I'm making jokes about the whole ECG dots and everything. I've got to work with what you've got.
Happy thing.
Happy thing.
That's what I say to the patients. Because if I go to them, I'm going to percuss your stomach now. They're like, sorry, what?
And do the noises go bloop bloop?
Bloop, bloop. Very accurate.
4 quadrants. Yeah, really.
So 6 quadrants. I did a 6 quadrant one. I also
9 quadrants.
the whole kind of 9 quadrants, which wouldn't be quadrants. Oh, you're actually going to keep it like that. Right, what one am I missing? Psoas, obturatorus. I've done them.
Done rebounds, done
Yeah.
those things.
Does it matter? Do you want both types of psoas done, or maybe if I do?
I'm only doing one.
Yeah.
What one do you do?
Pull the leg. The one that you just did.
That's
Pull the
fine.
leg back.
Yeah, that's fine. Just kidneys now, isn't it?
No, cholecystitis and then kidneys.
Yeah, and then kidneys fine.
Yeah, carry on popping.
I was going to say with the kidneys, I can't remember. Do we ballot the kidneys in here, or we just check them for the cost of
We do that.
Yep, so either. So see what it says there, you can do.
Have you paused it, Gemma?
Yeah, pause.
Oh.
So in the answer guide, I think in the special test about.
Yeah, it says don't block because it's patient cruelty. You get so many people telling you to do it on the road, and I said no last time because I don't know how to do it, and they're like, honestly, just do it.
What, punch?
I do.
Yeah. If they've got kidney pain, they'll seem to. Yeah. So one could do one and one could do the other if you want, or we can just.
I can't do that.
How nice. It's kind of hard though as well because as you can see with the positioning, you know, getting it to sit forward. Excuse me. Oh, sorry.
No, usually you can do that one.
Yeah. I'm just gonna lock the door actually. I've got visions of Scott coming in. Because when I said I was videoing you two down here, it's like, oh, what? He says, can I be the man that has to come in and fix the machine?
Oh God.
Okay, so that's the test for the appendix done. So what I want to do now, just going to test for cholecystitis. So that involves me popping my hand underneath your rib almost. I'm going to ask you to take a nice deep breath in. Okay, Sarah?
Yeah.
So trying to kind of hook my hands underneath the costal rib margin. Take a nice deep breath in. Okay, so that's normal. So what I'd be looking for there is if there was an abrupt stop, that means that the lungs are pushing on the gallbladder, which would be inflamed, causing increased pain, which is causing them to stop halfway through the breath. But that seems all right. So we're going to do one last test. And that's all I'm going to do is just palpate your kidneys, okay, which means I'm going to give you a little bit of a squeeze on each side, okay. So looking for the costal vertebral angle, which according to the GP online is just between the last rib and the angle of the spine. Just popping your hands, both one behind the back and one in the front. Nice solid squeeze. I'm going to do that on both sides. I'd come around that side, but don't want to block the camera. There and there. Let it be the positive pressure like that. So it's quite hard to feel the kidneys. However, if there was any kind of stones or inflammation, pushing that pressure on there would cause increased pain. Okay, Sarah, cover yourself up now. So that completes all of the abdominal assessment there. So I'm just going to, before I leave, just get a little bit more information from you, if that's all right, Sarah. So I just want to ask about kind of your sort of social situation, your family history, anything like that. Okay?
Yeah.
Cool. Let's get you comfortable because you do not look comfortable there. So, first of all, are you on any kind of regular medication?
Just a contraceptive pill.
Just a contraceptive pill. How long have you been on that?
About 5 years.
Okay. Have you had any problems with it at all?
No, it's all been fine.
Do you get regular checkups on your blood pressure or anything?
Yeah, that's all fine.
Lovely. Okay. And so, with the contraceptive pill, are you sexually active? Don't mind me asking.
I am, yeah.
You are. Okay. Is there any chance you could be pregnant?
Oh, no.
No. Have you had any children?
No, I haven't.
No children at all?
No. And
who do you live with?
My husband.
Okay. Oh, is that your child over there?
Oh yeah, I forgot about him. Her.
What was it?
Where does it say this?
That's right, because I remember specifically that there was children.
I didn't. Yeah, there's something else.
No, don't worry.
Yeah, don't worry. We can keep it that she doesn't have any.
Oh, okay.
Yeah. Oh, didn't we put? Oh, okay, there you go. I'm just making it up.
You're so forgetful, I didn't. I think we should keep that in.
Yeah, I think we should.
The bloopers edition.
Mine can be the bloopers and Aisha can be the confessional one. Do you know what? You didn't get those during my genuine OSCE. You know the whole thing, and I say, oh, put your hand, so give me a high 10. Rob did it. I actually gave him a high 10. Right. Right. I've completely lost where I was. Right. Children.
Yeah. Yeah, I've got a daughter.
Okay.
Right. I'm just going to press record again. Okay. Is it recording? No, not yet. Okay. Okay. When you hear the little noise, it will be recording.
Okay. So yeah, you've got one daughter. Have you? Any complications during the birth at all?
No, none.
No. And who do you live with?
Just my husband.
Your husband
and my daughter.
and your daughter
Yeah.
that you occasionally forget about.
Yeah.
Oh. Mother's Day on Sunday, maybe she'll forget about you. Okay, so any problems at home that I should be aware of?
No.
No? How often do you smoke or not at all?
I don't smoke.
How about alcohol?
I have about 12 units a week.
12 units a week.
Yeah.
Have you ever thought about maybe cutting down a little bit?
Not really.
No? Okay. Do you feel like you need alcohol?
No, I feel like I'm dependent.
No.
Just enjoy
So
it.
a lot of the tests that I did there was just kind of a test on the liver. In the UK, the biggest cause of kind of liver cirrhosis is alcoholic liver disease. So just be aware of that when you're having your 12 units a week.
Oh, okay.
Okay. How about your diet? What's your diet been like?
Yeah, normal.
Okay.
Diet. Eats not well.
So I remember earlier you were saying that you're passing urine and opening your bowels as per usual. Has there been any sort of stinging, any darker colour?
No.
No, nothing at all. No strong smells when you go to the toilet.
No.
And your bowel open, bowel movements, have they been all normal?
Yeah, they'll be fine.
Yeah? Okay. So with your family history, anything of note, anything that I should be aware of?
No.
No?
No.
No cancers, no strokes, no heart attacks?
No.
You're fitting well normally?
Normally, yeah.
Fantastic. Okay. And have you had any kind of medical conditions before?
No, I haven't.
No
Quite
stays in
healthy.
hospital, no operations?
No.
Just the birth of your child then?
Yeah, that was the only time I was in hospital.
Okay then. So socially, you're up and you're mobile normally?
Yeah.
And so you're saying that you've been sick. Have you been able to keep any fluids down?
Yeah, I've been sipping water. I've been able to keep water.
Okay.
down.
So what we normally say for every time that you're sick, you should have a pint of water. If you're feeling sick, make sure they're like little sips. Don't just try and gulp it because you'll never be sick again. Food, try and keep kind of plain stuff like dry toast and things like that. And we don't want anything too exotic. No curries or Chineses, no matter how much your poor daughter may beg. And yeah, just try and keep it plain, and hopefully we'll try and keep your fluids up, and that will get you on the road to recovery. Is the pain still there at the moment?
Yes, it is.
It is. Okay, so there's a number of things that it could be. I know that you're saying that you haven't got any kind of symptoms for it, but because you have got that increased temperature, even only slightly, and you have also got higher BM and you're not diabetic at all, that could indicate that you've got an infection somewhere. Could be a urinary infection with the way that you're saying that the pain is. I know on the right hand side I did that test and it was negative. However, there is a chance that you could have appendicitis or that your gallbladder could be inflamed. So we've got all of those. So I think, as I haven't got x-ray vision or an ultrasound in the back of my ambulance, that a trip to hospital would be best, because obviously I can't leave you here if you're being ill and you're not comfortable. I'd be a lot happier if you were to go to hospital and get it checked, just to see if you have got any sort of ulcer or infection or something that needs a little bit more attention. How does that sound?
Oh, I have to.
Yeah, I'm afraid you do. Now, is your husband at home?
Yeah, he is.
He is, so he can look after your daughter. Okay. Have you got any questions at all?
What's wrong with me?
Yeah, what do you think it is?
So, as I said, it's quite hard for me to diagnose something specifically. The stomach can be very confusing. It's got a lot of things in it. But the pain on the right-hand side could be the duodenum ulcer. We could have the infection, urine infection, cholecystitis. You could have appendicitis. You could have a viral bug. Could be pregnant. I know you said that you're on the pill, but it is a possibility, as you have said, that you are sexually active. Just want to make sure that everything is running smoothly. Does that sound all right?
Yeah, that's fine.
Any other questions at all?
No.
It's nice to meet you. Now get in the back of my van. Excellent. How was that? Yeah, it's a lot more fun than the other Oscar.
I think you still had fun in your Oscar in your first one.
Yeah, I did.
Oh, you told me to shut up, didn't you?
I did tell you to shut up. I told Gemma to shut up and gave Rob a high five. And
Yeah.
high 10, sorry.
Excellent.
I also laughed at Rob because he dropped his